button and hopefully it should begin. Brilliant. We are here, we're online, we're ready to go. So thank you all for coming along this evening. My name is Shona Okeke. I'm a Senior Engagement Officer at Birmingham City Council. I wonder if my colleagues on the call could also introduce themselves. If we start with Emily, please.
Yeah, hi everyone. I'm Emily. I'm one of the public health grads in the team. It's so great to be with everyone here today.
Thank you. Andrea?
Everyone, my name is Andrea and I am the engagement officer.
Brilliant. And Dr. Damilola, your first meeting, welcome.
Oh, yes, good evening, everyone. Name is Damilola Kishilure, public health consultant, taking over from Medical Manager. Nice to meet you all.
Nice to meet you.
And the man that needs no introduction, Dr. Justin Varney.
Hi, I'm Justin Varney. I'm the Director of Public Health at Birmingham City Council.
Brilliant, thank you. Let's jump straight in then and start with our COVID dashboard. I'm going to present it on the screen, and Justin, if you'd like to speak to it, is that okay? Great.
Yep, that's fine. I'll wait for the wheel to turn and it to come up. Oh, brilliant. So there we go. So as we look at the picture of what's going on at the moment, we are starting to see case rates coming down. Really important, I think, to know we are monitoring what we're seeing in terms of COVID in wastewater as well as people testing. So this is really important because, as you know, testing rates have fluctuated a lot over the last 2 years. And there are times when we're all great at testing twice a week and reporting it. And there are times where people are not so great. And because we're able to look at COVID by sampling wastewater, we can get a sense of whether the testing picture and the wastewater picture look the same. And because they're roughly heading in the same direction, we're pretty confident it is a real reduction. It's not just because people have stopped testing, which is good news. The other thing is we are starting to see the percentage of tests that are reported as positive, and that's from the people who've got symptoms from the PCR tests, that's coming down as well. So overall, downward trajectory, and it is a true downward trajectory, which I think is really good. If we go on to the next slide, please, Shona. Great, so pattern across the city, still changing. And I think, as we've said to you before, one of the things we think is going on is that we know that vaccination isn't perfect at stopping you catching COVID, but it does reduce your chances of catching it and your chances of passing it on. Alongside that, immunity, if you've caught COVID, you will get some natural immunity, but that doesn't last forever. And we know that if you caught Delta, protection against Omicron is really not that good. There's quite a lot of people that unfortunately got Delta around November and in January caught Omicron. And that's because we know that the natural immunity protection, because your body's learned to see the whole virus, not just the button on the coat of the virus, if it sees a virus wearing a different coat, it doesn't respond. And that's why natural immunity, because it's more specific, is not good when we see variants come. So the pattern of infections we saw across the last couple of weeks is we've seen very high rates in the north and very high rates now starting in the south. And we think what's happening is some of that is people's immunity from their vaccine is wearing down and they're due for their booster to get it back up. But the middle of the city, which was hit hard with Delta, have still got a bit of protection from Delta that's giving them a bit of defense, because the vaccine uptake in the centre and band of the city is not as good. So there's a combination of things going on. Some of this is natural immunity. Some of it is people are due for their boosters. And we know if you haven't had your booster, your chance of catching Omicron is higher than in people who have been boosted. And then that kind of time phasing of when people were jabbed is starting to play out in the different patterns across the city. So that's why we're seeing it moving around a bit at the moment. So if we move on to the next slide, and you see that reflected in the ward data. And I always think the map's easier to read than the table, but you've got the numbers here if you need them. So if we move on to the next one, vaccine uptake. Now, you will probably see in some of the media, Birmingham getting a bit of a bashing for not being great overall. And that's because if you look at the national data, we're looking at all vaccinations in people over 12. And because we've got a lot of young people, and particularly a lot of young adults that haven't got their vaccine started yet, that's dragging us down. But what you can see from this is the purple line, which is the first dose. In those that are most at risk, so in the over 65s, over 90% of people have had their first dose, just under 90 have had their second dose, and over 80% have had their booster. So in the people that are most vulnerable, we're definitely, the NHS is doing what it says on the tin, getting people protected. Where we really need your help is getting younger adults to understand this is important. And I think that the thing to really kind of stress in that is that the evidence around the impact of having the vaccine and not having the vaccine, at every age, it makes a difference in terms of your risk of hospitalization and your risk of death. And it's absolutely true that younger people are less likely to end up in hospital and less likely to die. But that doesn't mean it doesn't happen. And what we see is that at all ages, there's at least a 10-fold difference between being vaccinated and not being vaccinated when it comes to death. And it's a much bigger difference. I can't quite do the maths because it's like 240 versus 5. It doesn't match neatly into a 10 times difference, but it's a really big difference when it comes to hospitalization as well. So even in younger adults, it's worth having. The other thing that's important, and we'll be trying to get more of these numbers out to you over the coming weeks to help, I think, is that there's increasing evidence that the vaccine reduces your chances of developing post-COVID syndrome, or long COVID, as I think most of us call it. It reduces your chances of having serious symptoms that stop you doing the things you want to do today. And what we know from the data is about 7.5% of people across all ages who catch COVID get post-COVID syndrome to a point that it is reducing their ability to do day-to-day things. So we talk about activities of daily living, being able to dress yourself, being able to do your own shopping. And 7.5% people have symptoms from COVID 12 weeks or longer after being infected, that's making those things harder to do. And we know that the vaccine reduces your chances of developing long COVID. So I think really, really important message there to get across to people to help understand why vaccine is important at any age. And I know there are lots of concerns about risks and side effects, and we will be putting out more information on this. But just to put this in perspective, we talked to you before about the risk of a serious blood clot. The risk from the vaccines is about 4 in 100,000. In terms of the risk from catching COVID and having the same kind of serious blood clot, it's about 16,000 in 100,000. So it's a big difference in terms of the scale of the likelihood. When you look at inflammation of the heart, myocarditis, this thing that people have been worried about, there are about 40 additional cases from what you would expect due to COVID. From Pfizer, there's an additional 1 associated with the vaccine. So really big differences in the numbers. And we know we've got to do more to get some of this data out there, but it is science and research that's still being published and coming forward. So just moving through the next couple of slides, Shona, we've put in the pack for you where we need your help most in terms of getting first dose up. And as you can see, we've still got some areas of the city, particularly Newtown and Holyhead, where the uptake in the more mature groups, almost said elderly there, and I'm almost moving into that age group myself. More mature groups, we need your help getting them over the line. But really, in many of these areas, particularly kind of Holyhead, Soho and the Drury Quarter, young adults, less than half have got their first dose. The NHS is making sure the offer's always there, so helping us get that over the line. We've included in the pack the second dose. Some people had the first dose, didn't have a great time with it, are kind of going, oh, I don't really want to feel like that again. In general, well, two things. One, very, very rare to get a serious side effect with the second dose if you didn't have it with the first one. So if your first one, you didn't end up in hospital with it, you're not going to end up with a second dose, causing problems. But the other thing is there is no rhyme or reason. Some people second dose, some people booster dose, got a kind of fluey 48 hours. Other people just got a sore arm, were absolutely fine. So, you know, really important to say there isn't really a kind of rhyme or reason whether you're going to get that 24 hours of grogginess or not. And then the final map we've got in the pack is the booster dose. And as you can see, in some areas where they were vaccinated earlier, you know, we know some parts of the city people were really efficient at getting the vaccine early on. They're going great guns and getting the boosters. Areas where people started their vaccination journey later, particular areas like Alum Rock, where brilliant work by champions and partners who really brought up the numbers in Alum Rock, but that was really a big push over the autumn. So they're not eligible for the booster yet. You know, they become eligible over the next couple of weeks. So when we look at the booster map, we are keeping in mind, you know, a lot of people in these areas aren't eligible yet. Final bit I want to just say about vaccination is if you've caught COVID, if you're an adult, you should be waiting about 28 days to get your jab. So if you do your first dose, second dose or third dose, doesn't matter which dose it is, if you caught COVID, you should wait about 3 to 4 weeks. It's not a clinical contraindication. So what that means, if you're a little bit early and you go in at 20 days rather than 28 days, the NHS is not going to turn you away, okay? It's not putting you at any greater risk. So that's important to know. For children, it does depend on the age of the child. So there's information on the NHS website about it. But for younger children, it's a longer gap. And that's because children's immune systems are super efficient. So they get a really good natural reaction, and they also get a good reaction to the vaccine. And so giving them that second dose or their booster when they've just had an infection is a bit of a waste of the learning. We want them to start to forget again before we give them the booster. So that's why that time difference is slightly different for children. It's because their immune systems are just better at learning when we give them vaccines. So hopefully that's been helpful. I'm sorry, I probably went on a little bit too long, Shona, but I thought there's some important points to share with people. Thank
you, Justin. You always do such a great job of kind of so succinctly putting those really difficult messages into really short, snappy phrases. I really like the idea of COVID, of my body being like the COVID being like a button, like a coat. That's really, I'm probably just going to re-listen to this and use that example everywhere. So thank you. We have quite a busy agenda this evening, but I think it would be useful to take 10 minutes perhaps for any questions that people wanted to raise before we move on to the next item.
Just while people are thinking about questions, Shane, some of the champions who've been with us since the early days will remember the button analogy. So I'll just run through it again for everyone because I think it's a really useful one. If you think about a virus, it wears a coat like we all do. And when it's cold and we go outside and we go somewhere different. So the virus wears a coat that protects it. And that coat has on it buttons, and the buttons are the things that stick it to our cells. They're called protein spikes. And they're the bit that the virus doesn't really play around with too much because it's fundamental. It's a bit like a key in a lock. You know, once that button latches on, the virus is connected to you and it can invade your cell, and that's how it reproduces. The vaccines all work by giving us the recipe card to make our own buttons. We don't make the whole coat. All we do is make the button bit of the coat, and we make basically a handful of buttons that our body sees and creates antibodies to. So our antibodies from the vaccine are trained to look just at the buttons. If we see anyone wearing a button that looks like that, we produce antibodies. When the virus gives us natural immunity, our body's seeing the whole coat. It's looking at the fabric, it's looking at the pattern, it's looking at the buttons as well. So it only reacts where it sees the whole coat. And that's why there is a difference between natural immunity and vaccine immunity. Vaccines really focusing on the buttons, and the buttons don't really change that much between the variants, which is why the vaccines still work. If we get a variant where it really changes the button, we will have to get a new vaccine, and there are processes to get that ready if needed. But I thought it was useful just to run through the button analogy again, because it does, sometimes we use all this science speak for protein spikes and everything else, And actually, if you just think about it, it's the button on the coat, and that's the bit we're training our body to recognize, because that's one of the bits that doesn't really change very often.
Brilliant, thank you. Are there any questions? Teresa, please take yourself off mute and go for it.
Hi, thank you. I'm in Northfield, and I hope you don't mind if I ask a very Northfield specific question. I'm a little bit confused about, I think I understood you saying that some of the areas that are getting higher cases now, it's because their immunity is worn off and they need their boosters. But Northfield is very high in terms of boosters. So I'm not really understanding why we've got significantly high cases, but also we're very good at having our boosters. So if you could just explain that a bit better, that would be helpful. Thank you.
Sure, Teresa. And it's not a perfect science, I should say, on this, because what we're seeing is that the reason we bought the booster campaign is to bump up your antibody levels, because the vaccine's not great at stopping you getting infected. It's very good at stopping you dying. It's very good at stopping you ending up in hospital. Not great at stopping you getting infected. And the more antibodies you've got, the better chance you've got of not being infected. So what we tend to see is in areas of the city, and this is why I say it's not perfect, but in areas of the city where they were good at getting their vaccine, and they're kind of now it's the time where people are getting their boosters. What we're seeing is that a lot of people are getting infected when their booster was due, or just after they've had their booster. So a bit like when we got the vaccine to begin with, you remember it takes about 2 weeks for the body to really bump up its supplies after the vaccine. So people are in that kind of vulnerable phase of their immunity from their first 2 doses is coming down. They may have just had their booster, or they're due their booster. There's still a window of about 2 weeks where they haven't got that antibody level up, and they're really vulnerable to infection. And what I think that's what we've seen. I mean, as I say, it's what I think. There isn't great amount of science about this, because we can't track everyone against when they got vaccinated, when they got infected. But certainly from the anecdote and also the patterns across the city, I think that explains some of the geography. It certainly explains some of what's been going on in Sutton Coldfield, because when we looked at Sutton Coldfield, we looked at age demographics, for example. And yes, in all parts of the city, we've seen a lot of COVID in young children who are unvaccinated. But what we were also seeing is that the age group that were catching COVID were really in the 40 to 55 age group. So they were the group that generally got vaccinated around the beginning of the autumn, late summer through to autumn. They were really picking up their vaccine coverage. What we haven't seen in Sutton Coldfield or any of the other parts of the city is high infection rates in the elderly. And they're the group that were boosted first. So that's where this theory comes that we think this is probably about people where they are on their booster cycle, and the fact the booster does take a couple of weeks. So unfortunately, Omicron is spreading really fast, and if you haven't been boosted and you're not close to one of your first 2 doses, you are still pretty vulnerable to catching it. What's good news though is you're not ending up in hospital. Does that make sense?
Yeah, thank you. Appreciate that.
Are there any other questions for Justin at this time? You're very welcome to put something in the chat if you'd like. Okay, we will move on. So we mentioned last week that we really want to spend some time saying thank you to all of you for the brilliant work that you've done. And so my colleagues and I have come together to put together a short presentation, just to review, I guess, the journey you as champions have been on, and to perhaps talk a little bit about where we might like to go to next. So I hope you'll give me a few minutes of your time to do that. So let me share my screen.
Shona, you're on mute.
How strange. Let me try that again. Okay, can you hear me?
Yes.
Great. Good. Okay, so yes, as I said, thank you all for coming this evening. We just wanted to spend some time to say thank you for all that you've done over the year, just to give a bit of appreciation, a short reflection over all that you've done, and just to say that I hope you all know that you've all played a massive role in trying to overcome COVID and this pandemic. So yes, please, a few minutes of your time just to kind of look back and look to the future would be brilliant. So this is a quote from Henry Ford, and I know it's very cheesy, but I think it kind of sums up the way we've been working over the last year. And before this scheme was together, the year before that, coming together is a beginning, keeping together is progress, and working together is success. And we have had to come together. Last year, you decided to sign up as champions. We've continued to meet and keep working together, coming to these meetings every other week, and then sharing what you're learning with your communities, with people that maybe you may be more familiar with, and for those who you're less familiar with. So actually sharing that message with strangers is probably one that's really weird, but you've continued to do it, and it is we are seeing improvements in things. We are seeing uptake of the vaccine going up slowly, but it's going. We are seeing a better understanding of what's happening around COVID. We're all working together, and I think as we start to move into a new period of living with COVID, I hope that this kind of working can continue into the next year. Now, I'm sure you all remember that first ministerial briefing that Boris Johnson gave in March 2020, that told us all about the new restrictions and the lockdown measures. And I wonder if you can remember what you were doing at the time. And I'll tell you a funny story. In February 2020, there was Storm Francis, which hit the south of the country. And my car was actually crushed by a tree, so completely teetotaled. And you know, it wasn't fine, but it was fine. I didn't really need my car, so I was kind of chilled about it. And then at work, started to hear that, oh, this talk of a pandemic, and you know, I think the day before I eventually bought my car, there was news that we would be potentially going into lockdown. And so I completed buying my little secondhand car on the 23rd of March, and I decided to spend my last evening before lockdown just driving around London and seeing what it would be like at night time. And I would tell you, it was dead quiet that night, and I definitely didn't expect that we would be in lockdown for as long as we were, but we were. So there you go. That's one reason why I really remember exactly what I was doing at that time. And so I thought it would be useful for us, before we start looking forwards around what this group will do in the future, that it'll be worth looking back as well. So it's been a really crazy few years, and a lot of things have happened. And before we get to the nitty gritty, I thought it would be useful to go through some of the experiences that we've all had together, which I'm sure not just something that we would have gone through together in the UK, but perhaps all around the world, we're doing all these same things at the same time. So for those of us who worked from home, where we could, that routine of working in pajamas, potentially I would never admit to doing that with my boss on the call, of course. But I do know it was very difficult some days to get out of bed and put my work clothes on and sit in front of a screen. I don't know if anyone remembers the banana bread phenomenon. I personally didn't partake in that. I did decide, however, to perfect a perfect roast chicken, which I think is pretty good now. And I definitely enjoyed a lot of banana bread deliveries that were dropped off at my door as people were doing their mandatory walks. And after all this eating and drinking, we all also tried to do the whole home gym thing. I don't know if anyone did that as well. Some pretty painful experiences trying to do lots of 100-rep sit-ups and all these things from home, which was absolutely awful, but there you go. And for some of us, we took the opportunity to just complete Netflix, impressively redo our homes and all these really cool DIY projects, which is not for me personally, but it's very impressive to see what people have done with their time. And something we all would have experienced is a lockdown birthday or a pandemic birthday to some degree. And depending on the month you were born, you may have had the chance to see friends face to face. And for some of us, we had using the ingenuity of Zoom to do something quite exciting to bring our loved ones together. And now outside of that, obviously this is all in the context of a very serious pandemic. So in January 2020, the WHO declared a public health emergency, and by March 2020, we were in our first national lockdown. And as I mentioned, majority of us were at home. We were exercising once a day. We weren't seeing friends and family. And, you know, for some people, being at home was a well-needed rest from a very, very busy city life. So for some of us, we may have thrived under the peace and quiet of not having to be in multiple places at once. But for some of us, it would have been incredibly difficult to be away from our friends and family. And I'm sure that we all experience and we're all touched by a level of loss and a level of loneliness that has kind of rippled throughout lots of friends and family. And for some of us, we got a chance to spend lots of really close time with our family. And for those of you on the call who are teachers, who are parents, sorry, you had to become teachers as well. And so again, I don't know how you did it, maintaining a household, maintaining full-time jobs and looking after kids and becoming a teacher. My hats off really do go out to you. So moving throughout the year, we saw a range of developments in the virus, with the Delta variant coming out in November. We had to wear things like face coverings. We were changing the way that we met with our friends and family. I personally spent a lot of time outside, more than I've ever done. It feels like in my entire life. I've never had so many picnics in my entire life. Rain or shine, we were all together, really trying to grasp what it meant to really catch up with our friends and family in a way that was really, really safe and completely different to where we have been. And then we went into winter. And I don't know if you remember the 3-tier system that was set up, learning about the Delta variant, and then that little glimmer of hope on the 8th of December when Margaret Keenan was the first person to be vaccinated. And that kind of started the change for what the future could look like, a positive change, a hopeful change. We went into our third lockdown just before Christmas, and I think I can speak for everyone that starting 2021 in a lockdown was quite difficult, but at this point now the vaccination program is in full swing. As I said, we're seeing things changing. We're seeing things like shielding protocols changing. We are meeting with our friends and family, and then by September we were really pushing the booster campaign, which was sped up with Omicron being kind of discovered, that new variant of concern. And now we're here in February 2022, somehow, just like that, 2 years has gone by. And there have been lots and lots of ups and downs. And throughout that time, you have been here talking and learning and being public health advocates. So I wanted to just review and show you some of the things that we've talked about over the years, or over the year, just to kind of show you that I hope you know that you are incredible, you are brilliant, you are able to understand this weird jargon science speak about all these things: vaccines, masks, positive behaviors, case rates, test rates, winter plans, just all this stuff. And you've done a brilliant job of being public health advocates in your local area. You've done a brilliant job of flying the public health flag. And I just think it's really important that we really, really recognize that. So what did 2020 look like for you? When you woke up January 1st, 2020, take your mind back there. What do you remember? What were you planning and hoping to do that year? What healthy habits did you begin over lockdown? Did you remember when you decided you could go on your first holiday and kind of move freely? What was it like reuniting with your family or your friends for the first time in months? Part of our story of being champions, of you all being champions, is that it was so strange and quite stressful, I think, for all of us to really step up to try and make things better. Considering that everything was completely chaotic, you all took that step to say, I want to fly a flag for my community. I want to share information. I want to put myself into this, directly into the eye of the storm to try and make things better for the people around you. And I know that part of that has meant that you've had to sacrifice some of your time. You've had to do things quite differently, but you've had to be brave to speak the truth, especially where there has been lots and lots of noise around misinformation around vaccines, around COVID, around all that stuff. You have all put yourselves on the firing line to combat all of that. And so I really wanted to speak one-to-one with the champion and really hear what that journey was like. So I had a chat with Penny. Penny and I spent 30 minutes talking the other day about what her experience has been like as a champion. And I hope that I'll be able to play this video now for you, so we can all hear that experience together. So if you'll just give me one moment to sort that out. Penny, don't laugh, Penny. It's going to be fine. Okay, I've edited it down. It's going to be fine.
I trust you. I'll be giving you marks on it afterwards. You do know that, don't you? Are we going to stay friends or not?
Can you hear that?
No, I can't hear anything at the moment.
Okay, give me 1 second. Let me pull up the video again. The joys of technology. So first I wanted to... Right.
Ready?
I think so.
Going live. In.
Can you see my screen?
Yep.
Can you hear?
Okay,
can you hear that?
You need to turn the volume up on the actual file itself.
It's at 100. From what do you do on your usual day to day? Is that okay?
Yeah, that's it. You got the levels now.
Brilliant, perfect.
Well, I'm from Drewty in Birmingham, which is south Birmingham. And during the day, I am the station manager for Hope Radio.
What's the main thing you hope to do with Hope Radio?
Okay, so Hope Radio was set up at the beginning of the pandemic, which is for the over 50 predominantly. But basically for anybody who hasn't got access to the internet, which is at the moment here in 2022, there's currently, I think it's about 1.5 million people who haven't got access to the internet at the moment.
And how is that your role as station manager weaved in as with your role as being a COVID champion?
Okay, so the two things fitted together very nicely, because the role of a COVID champion is to be able to take the information from yourselves at Public Health and deliver it to the community. Now, a lot of people have been doing that via social media, but what we've been doing is we've been doing it via the radio station. So we've been setting up like little jingles and things. If you're going to go out there, wear a mask, show you care. And then the news, spread the truth, not the virus. Put out different leaflets, and we've created little Jeff characters, which have got QR codes on the bottom, which people can read, and little T-shirts and things. So we've basically been looking at how to get the message across, but for people who haven't got access to the internet. So as we're all old anyway, we know all the old school ways of doing things. So that's how we've been doing it. So we come to you guys all the time, and you give us all the information, and then we reinterpret it in a non-digital way.
Yeah.
And then give it out. We've had various different. We've written poems, community poems, where the listeners have each sent in a line about how they feel. We've done haikus of hope, We've seeds of hope to try and sort of like bring people together and sort of like look at the messaging and things. And you know, as we're organising events, sort of like discussing around risk assessments and stuff, and introducing sort of like as things have changed. I mean, yeah, in fact, we've completely and utterly reinvented radio.
Why I love talking to you is because you've taken something that you kind of done in, day out, and made it into something that just fits and works with people. Yeah, it's just brilliant. And like you said, you completely reinvented it, and that's really exciting, especially as we start to move to a new time where we now have to live with COVID, which is kind of scary to think about. But you're doing a great job at making people feel safe and familiar with all that's to come. I'd like to take your minds back a little bit to March 2020, when Boris Johnson announced the lockdown. What were you thinking at the time? How did you feel? Where were you? Do you kind of have any recollections about just that moment?
Do actually, because I graduated with an MA in media production in January of 2020. And that's how I've got all these new skills, you see. I was supposed to be doing a job for the National Trust. We were doing some audio recording, and you know, my first big job, sort of like out of university. Woo-hoo, National Trust, get me. Right, and that felt through. So basically, I've got loads and loads of time on my hands. I was supposed to be going and visiting. It was the first anniversary of my best friend's death, so I was supposed to be going and visiting his grave. I couldn't do that. Yeah, my friends were phoning me up. They were all worried. I've got lots of creative arts and crafts friends as well, and you know, they were all phoning us up, and we'd got planned to do this, and you know, we planned to do that, and we can't do this, we can't do that, we can't do the other. And I was just like, there's got to be something that we can do. Before we started Hope Radio, we started an organisation called Brum Community Media. And what we did was we scoured the internet. It was an online Facebook group. We scoured the internet for information about food banks and help and stuff like that. And we just kept reposting sort of like other organisations that were doing stuff. So we were kind of like providing a little bit of a news service as well. So then we decided that we wanted to do something creative as well as the news stuff. So we created a 3D virtual reality art gallery.
Wow.
With no funding. I think we got about 12 different artists in there, audio recordings, little videos, real painters, real proper people, do you know what I mean? Proper artists that had done the work. So it was about just trying to occupy ourselves. I mean, a lot of my friends anyway are of the grey-haired variety, shall we say, and you know, kids have left home, kids have gone to university. My last daughter's just gone to university, so she was away, and yeah, it was, as a very 80s thing to say, it was the loneliness that was the killer. A lot of people were losing their marbles, really. So, you know, what we tried to do was sort of like make sure that we picked up everybody and pulled everybody in one way or another, so that none of us slipped. And you know, okay, we have lost quite a few. I'm not saying that we haven't, but we've tried to just provide a support network for each other, really. You know, a way of, you know, just, you know, we got the phone put in, and you know, people can phone me up and just have a chat. And then when they found out I was one of these COVID champions, they were then phoning me up going, Penny, I'm thinking about doing so and so, so and so, so what do you think?
Wow.
And this fountain of knowledge, which was great, because, you know, it was, you know, you guys were giving me the information, and all I was doing was passing it on. I didn't even have to do the research. It was great. I mean, I had semi-retired. I had no intention of coming back to radio. I was thinking of doing some little projects on my own, maybe, or you know, doing some teaching or some lecturing, you know. But the world had other things in mind, so I just had to put my big girl pants back on and do the job that was in front of me, to be honest.
That's it. And I think like you, many people have kind of sacrificed that time to just do something for their community, for their loved ones, for their neighbours. And it's kind of restored my hope in humanity a little bit, if I'm completely honest, just to see people just come together, which leads quite nicely to my next question, which is what have you learned about yourself and about your community over the last 2 years?
When you work in sort of like charity, third sector, public service, shall I say, do you know what I mean? You work with yourself. You can get burnt out if you don't look after yourself and if you haven't got the right support. And we know this. But I think one of the problems is that I got burnt out after about 6 months because it was full on. It was full on. I mean, we literally went from a standing start to a full-on radio station in 6 weeks, as well as trying to sort out all the COVID restrictions so that we could actually enable all these things to happen as well. And I think I've worked out that I'm not actually as strong as I think I am, which isn't a bad thing. I don't mean that in a bad way. And I'm a lot kinder to myself, and I'm a lot nicer to myself now than I was before.
Sometimes we do have to stop and pause and take stock and rest.
Yes, because we can become overwhelmed, not only with our own emotion, but also with the pressure of trying to be supportive towards other people. And if you're being supportive towards other people without any support yourself, then you can get yourself into an awful lot of trouble. So, and in the end, when it did come time to stop, you know, everybody was like, well, if we go for this funding, we can do it. And I was just like, no. We need to stop. We need to stop now. We need to take a break. And we did, and we took stock. And we came off air, I think it was for about 6 weeks. And that helped us breathe. And then we all started again. So then we went back on the air again.
What are your hopes for the future, Penny? What both COVID and non-COVID related, what do you hope for 2022?
For 2022, I would like to see a lot more of my grandchildren, please. I would like to see a lot more of my family, please. I would like to. I would like a life back. That's what I'd like. That's my hope. I know that we're not going to get back to the way that we were before, and in a way, maybe we don't. Maybe it's a good thing because now we are all being a bit more conscious. I mean, of health and of ourselves. I'm hoping to see a lot more people. I'm hoping to get out and about a lot more. Maybe even go down to the seaside. How cool would that be?
That'd be lovely.
It's having that time that has got nothing to do with work, because at the moment everything for all of us that are working through it. I mean, especially God, you lot. It's work 24 hours, 7 days a week, and we haven't stopped for the past 2 years.
It's everyone, like regardless whether you're working on the front line or working from home or working at a radio station, it's just constant all the time. And
even if you're working in a supermarket,
oh my goodness,
working in a supermarket. Imagine working in the supermarket. Wow, that's what I'm looking forward to. Is going to a beautician, getting my hair done,
yes,
a facial, a manicure. Look at my nails. Look at my nails.
Well, thank you, Penny, and thank you for just being a COVID champion. We are so appreciative, and like you and many of the other champions, you've sacrificed a lot to do the role and be a pillar and a light in your community. So thank you so much, and I look forward to seeing all the really cool stuff we're going to do next and for the rest of the year.
We've got loads planned.
Good. Thanks, Penny. Thank you. So that's Penny. Amazing, Penny. Thank you so much, Penny, for being so open and so vulnerable. But the great thing about listening to Penny is that it really made it very real, the work and the effort that you have all been putting in. It's just amazing. It's amazing to have listened. It's amazing to just really see how seriously you've all taken your role. And as much as this program was set up for us to be able to share information with all of you, you have all taken up the role to share your information with the people around you in the way that fits best with your skills, with your network, and ultimately make people feel really, really safe with the information they've received. So I know that was quite a long video, but I really wanted us to just spend some time to just yeah, have this as an example, but acknowledging that you've all in your own way done something really, really special to share information to keep people feeling safe, and your work has been so meaningful. It's not just impacted your communities and the way you're having conversations, but it's also fed upwards into the way we think about how we communicate with you, how we build campaigns, how we share information, how we create FAQs. You shape newsletters. You've helped us to really communicate, think about how we communicate guidance, and you've helped us at these meetings to really understand what is happening on the ground. So thank you so much. A lot has happened and you've achieved an awful lot, and you should all be extremely proud. I don't know if you all know, but Birmingham is kind of seen as the example, the model for champions programs in the UK. It's kind of in that top tier of champions programs. This group, these people, you all are seen as brilliant examples. And yes, there is much more to come. There is much more work to come, but you should be hugely proud of the work that you've done so far. And I know that this year that you sacrificed for this program will only put Birmingham in good stead for the future. So I would like to pass over to Justin now to kind of perhaps give his reflections on the year, and just to get me to stop talking, because I'm sure you've heard enough from me for now. Over to you, Justin.
Thanks. And am I able to screen share? Have I got permission? Great.
Let's see.
This is always the joy. So yeah, it looks like it's working. Great. Okay, I'll do that in a minute. So firstly, I want to just kind of echo Shona's words of thanks. You know, you guys have been with us on a journey over the last, well, 2 years really. The first case was identified in Birmingham around the first week of March. So we're just off a month from our 2-year anniversary in 2020. And some of you were engaged with us through our community partners ahead of the launch of the COVID Champion Scheme in the summer of 2020. And we learned from Newham, and we rapidly built and we rapidly recruited, and you've been on a learning journey with us for the last almost 2 years now. And some things haven't worked perfectly. There's been some changes in the team. There's been some times when it's been brilliant, and there have been times when we've all been sick to the back teeth with COVID, and you know, are bored of looking at maps and graphs and everything else. So, you know, a really, really honest and heartfelt thank you from me, because it is what you guys have done in your communities, in your personal, professional and social networks, which have meant that we've navigated this pandemic far better than anyone expected Birmingham to do. You know, if you looked at us on paper at the beginning of the pandemic, and some of you remember me talking about this, we were predicted between 2,500 and 9,000 deaths in the first wave of the pandemic. So far, we're running about 3,500, way below what's predicted. And that is down to the communities. It's down to the engagement. It's down to the partnership. It's down to the information that you've helped us translate and transform in ways that people understand. And that, you know, it's very hard. It's hard to do that from the council. It's even harder to do that from Whitehall. And do that nationally so that everyone understands it. So you've been a really, really important part of the approach. So what I wanted to do was talk to you about kind of the what next thinking, and use a couple of minutes tonight to just share with you my kind of vision of where I think we're going. And Damilona has joined us to take on that leadership space, working with Nadeem and Shona and the rest of the team to look at how we evolve our approach. And we take a lot of the learning that we've done through the COVID Champions programme with you into a model for ongoing engagement and collaboration and co-production for public health. And as Shona said, we are held up nationally as being like the bee's knees on this. There are other parts of the country, interesting, there are other parts of the country who started before us in terms of working with community volunteers who are now coming back to us and going, our program stumbled and faltered. You've kept people energized. You've found all sorts of different ways of doing things. How have you kept it going? And you know, I think that's really important to reflect on. So where I think we're going, and this is all a bit dependent on COVID doing what I think it will do, which is gradually die down. We'll probably have another wave in the autumn from a variant somewhere else in the world. And we've probably got about 2 years of vaccination cycles, not loads of boosters, but I suspect this autumn we will get an annual vaccination program for some age groups sitting alongside the flu jab. That would be my prediction, but it is a crystal ball gazing kind of, this is where I think we're going to go. So I don't want to lose the wonderful energy and the passion that you guys bring, but I do recognise that you don't want to spend the rest of your lives talking about COVID. So it's now time to look at, well, how do we engage you and give you opportunities to work with us on other public health issues and help us realise the vision of Birmingham being a city in which everyone enjoys good health and can achieve their potential in life without health getting in the way. This vision of a bolder, healthier Birmingham. So this kind of pyramid is trying to kind of describe what I want to evolve as the model for public health engagement with communities. And that's communities of place as well as communities of identity. And if you think about the pyramid, what we've got on it is we've got the bottom, and it's probably, a pyramid's not great because everyone talks about the pyramid having a bottom, but you know, when I was trying to do this as a circle, it all got a little bit confusing. And my PowerPoint skills are limited. So we've got a basis of the bolder, healthier Brum, what you know is healthy Brum, which is evolving and transforming our social media accounts. We're going to be launching a newsletter probably in the summer. So, you know, that kind of information cascade part of the bit. Then there's the development, building on the work we've done through COVID with you as champions and with also our engagement partners to develop a network of people who like that role of being information disseminators. It's relatively small amount of time commitment, but it is a contribution that makes a real difference. So that being a model of bolder, healthier champions and bolder, healthier network partners. And I include in that our relationship with faith leaders, which has been a really important part of our work through the last 2 years. Then there's a slightly deeper level of engagement partners, and they're people and organizations where we are probably funding the time because we're asking them to put in some serious hours into working with communities of identity or communities of place where we're still not getting engagement, where people don't trust the council, they don't trust the NHS. There's a lot more effort needed to get across and engage with. And we're talking about deep engagement partners, they're really organizations. We're talking about community collaborators and community collaborations. And that's where I'm thinking they may be funded, they may not, they may be about working with some of the great partnerships we've got in the city that are around particularly communities of place to work through. And then there's a new model that's emerging, or a new branded model that's emerging through the NHS at the moment, who are health and social care navigators. So these are people, primarily volunteers, who've got a little bit of extra training about how do you actually navigate our health system? You know, it sounds simple, but actually when you have a long-term condition, it can be really complicated. And I was saying to one of my clinical colleagues, even this morning, unfortunately, we've got a health challenge in our family at the moment, and my husband and I are both doctors, and we still struggle to understand how to navigate the instructions for outpatient clinics and admissions criteria and all of that. You know, and we're trained in medicine. We spent our entire careers working in the health service. So those health and social care navigators are kind of a slightly higher level of volunteers with a bit more training and to really help people navigate the system. But it's relatively light touch. It's a bit like a kind of wisdom person you go to that says that kind of village elder analogy of someone who you can ask for a bit of advice and they know enough about the system to help you navigate it. The next kind of group is around researchers. And this is where we're thinking that one of the things we want to offer champions, if this is the route they want to go, is some real skills development work. So some paid for training to support you around community facilitation. So if you wanted to become one of our community focus group facilitators or one of our community researchers, slightly different things. The community researchers do quite I think it's about a 6-week program of training to do scientific, methodologically sound research in communities. So it is a bit of a clipboard job. But we've been doing this in our maternity program as a pilot around infant mortality, and just talking to and hearing some of what the community researchers are saying. It's taking that engagement to a different level, because you're really driving the science and making sure that science and that evidence base is driven by the voices of real people in your communities. So great opportunity, something there. The community focus group facilitator is still shaping up as an idea, but this is about trying to provide support around the skill set of how do you actually facilitate community conversations. You know, most of us are really good at one-to-ones, but actually if we want to go into a group of people that we don't know, or that we know kind of well, but we know them as our gardening group and we want to talk to them about mental health, how do we have that conversation in a way that's safe for us as facilitators? Doesn't mean that next time we come see them, they all go, oh, you're the weird one that talks about mental health all the time. You know, they recognize this role. So, you know, I know from my own experience, that takes training. You know, that isn't, some of us are naturally great communicators, but even they need a bit of training about how to do it safely, how to be able to maintain your personal relationships and not get boxed into the you're the researcher, so anything I say to you is going to end up in a research paper and I'll suddenly see my quote on a bus stop. So, you know, there's a skill set we want to offer you the opportunity, if that's where you want to go, to make that path. And then the final bundle, which is, I think, at the kind of level of really doing one-to-one work with someone and really getting into that peer supporter, health coach space. It's a very specific set of kind of skills. There are jobs in it, some of them part-time, some of them are full-time, but looking at what can we offer you as champions to keep you engaged with us. We're still going to need your help on COVID for a bit longer, but making sure we're kind of paying you back by saying, these are the pathways we could support you into. And we've got some funding to be able to support training for people if they want to go on some of these journeys to help them get there. Because what we've demonstrated through the last 2 years of working together is that Birmingham listens best to Birmingham people. And, you know, that at the heart is why I've made sure and been really kind of strong on the team about the champions are fundamental to our approach. And this is why we value your time. It's why we make time from people like Madupe and myself, Hedi and others, now Damilola, to come and spend time with you as senior leaders of the COVID response, because you are our route to understanding what's real. And much as I live in the city, I only, you know, I try and get around a bit, but I know Ladywood really well. Going down to Druids Heath, I have to say, Penny is still a bit of a rare occurrence, except when I'm driving through on the way out of the city. You know, I'm very good on the
You and everybody else, mate. You and everybody else.
I know, but you know, although I gather there's a farmer's market down there I need to come check out. I saw something for, or some form of farmer's market I saw somewhere.
I think that's probably King's Heath rather than Druids Heath. You need to come a little bit further out towards the green belt and keep going.
Yeah, I do. The Alcaster Road, I keep going to the end. Anyway, so my point is, this is really valuable for us. So what we're trying to evolve as a team is some opportunities for you to keep working with us in this way, but recognizing that, you know, it's not necessarily doing the same old. And actually what we're trying to do in this model is give you some options. And as I put in this slide, you know, some of these around still information dissemination and tailoring to communities. Some of it's a bit more researchy. if that's where your interest lies. Some of it's more about behaviour change and support. So I wanted to bring it to you tonight because I thought it's a good opportunity. Stop scanning my screen. Good opportunity for any feedback, anything anyone wants to say. You know, brain dumped it a bit, and we will send out those slides to you, so you've got them to kind of go, give us feedback. Let us know, are there things that you think we've missed in the model? Is there a sudden group of people that we could kind of go, oh, they're not there, and you could create this kind of role, this kind of space. But also, if you look at it and you go, actually looking at that, this type of job, this kind of role, this kind of volunteering opportunity really excites me, and I'd love to work with you on making it real, then we'd love that. Because, you know, I'm all about co-production. I'm all about trying to find ways to make it work. And what I don't want to do is create a model that works really well for people in Harborne, but doesn't work well for people in Longbridge. So, you know, that's a really important part of this. So if you look at this and you go, you know what, I'm quite interested in being a health coach, but I'd want to be on the journey with you, then we'd love to have you to help shape that and develop it with us. So that's the offer. And I hope it looks exciting and interesting. And I'll shut up then and hand back to Shona. But if anyone wants to give any feedback, either do it now, or more than happy to take it over the next couple of weeks as we start to firm this up and we start to firm up the offers that go alongside it.
Brilliant, thank you, Justin. What we'll do is we can share our email address if you'd like to respond via email. Yeah, please do let us know what you think about all of that. It's really exciting, and I don't want to add too much to that, to be honest. I think I think it is what it is, and it's really exciting, and we hope that you can join us on that journey. We have now come to 7:05, run a little bit over. I just wanted to give my colleagues Emily and Andrea an opportunity to also give their thanks if they'd like to. I know Andrea's just put something in the chat now. Thanks, Emily. Just to give you a few minutes just to say something if you'd like to before we formally close the meeting. Oh, your mic's not working, no worries. Well, Andrea's been working with us for some time now, and I'll read what she says. A special thanks to all those champions who are here today, who have been part of this bumpy journey and have made a difference to our communities. Thank you for advocating for our communities, for being there to motivate our peers during such difficult times. Your efforts are certainly appreciated, and want you to know that your success is our success. Life has been a challenge to us all since COVID, but the fact that you're still here, you still turn up, you continue to inspire and motivate people means that you're strong, and we can only thank you for that. Finally, we have learned many lessons throughout this pandemic. I'm sure of that. One of the main lessons was to never give up, and that's what you all did. So thank you. So well done. You are being called champions for a reason. Thank you once again. And I think it's amazing because that's just with that, you now have an opportunity to step into a new phase of what this work can look like. So do have a think, do let us know, do email us at COVID-19 community champions at birmingham.gov.uk, or we'll be here in 2 weeks to talk again. So on that note, thank you all again. I will now stop recording this meeting, and yeah, enjoy your week, and we hope to hear from you very, very soon. Take care and stay safe.